So tell us a little bit about your health journey. How did it start? What kind of disease states and medications did you go on, and then how did you get off of them?
Yeah, so it's difficult to know where to start, but basically what I learned is everything I was taught at medical school was a lie and was not true. And so what I've had to do is unlearn whatever I learned at medical school. The approach of medical school is to treat symptoms with drugs rather than to treat diseases and to cure diseases. That they want you to be dependent on medications for the rest of your life. And I suppose this journey for me personally started off when I began looking at interventions for the treatment of the vaccine injured. I suppose that's really what triggered this personal journey for me. And, I came across the idea of intermittent fasting. I read the book by Jason Fung and realized really how potent an intervention this really is. And then I started reading about, metabolomics. There's an excellent book by Robert Lustig called Metabolomics. And then I read the book by Tim Noakes, who was basically put on trial for suggesting that a low-carb, high-fat diet had health benefits. And so, I realized that much of what we've been taught is a lie, just the same way as big pharma and industry controls the medical schools and big pharma. So does the food industry and the big food consortiums control what we eat, how we eat. And the USDA food pyramid is a complete fabrication. It's false and is completely upside down. So my story was I've been a type 2 diabetic for maybe over 25 years. I've had hypertension. I was on a PPI for reflux. And obviously I thought I was committed to be a diabetic forever and to take those medications forever. And that's obviously a big lie because type 2 diabetes is a treatable disease. It's caused by insulin resistance, which is really caused by our lifestyle. And it's likely that sugar and carbohydrates kill more people in this country than smoking ever did. It's a profound toxin. And, obviously most people do not eat food, real food. They eat processed food, which is not food. It's highly processed, high in carbohydrates, and high in processed vegetable oils. And this whole thing is a complete and utter scam and a lie. Then there's the cholesterol statin lie. So, we're told saturated fats are bad. Actually, saturated fats are quite good for you. What's bad for you is carbohydrates. So it's a complete opposite of what we're told. So whenever something is, low fat, that means it's high in carb, and that's the last thing you ever want to eat. So basically what I did, it was pretty simple. I tried to lose weight before, but the traditional way of dieting, which is exercise more, eat less, just simply doesn't work because it's not based on human physiology. And the whole concept is profoundly flawed. And that's why almost 90% of people who try lose weight by this mechanism within, 6 to 12 months will regress back to the mean and where they started. So I tried and failed. And, all I did was really two simple interventions. I started intermittent fasting because that's the way the body is designed. Yeah. We're not designed to eat all the time. And at the beginning, it was a little bit difficult, but like most things in life, the more you do it, the better you get. And with practice, you get really good at doing it. So I had an eating window of about 4 to 6 hours, from 12 to 6. And then with time, I was able to narrow that window to the point now where I eat once a day. And the remarkable thing is I don't get hungry. And the problem is with insulin resistance, it creates this vicious cycle where you're insulin resistant, which blocks the effect of leptin on your brain, makes you hungry. If you're hungry, you eat more carbs and more sugar, which causes more insulin resistance. So it becomes a vicious cycle. As soon as you break the cycle, you lose your appetite. So, I can go actually 36, 48 hours without eating and not be hungry. So it has to do with breaking insulin resistance and also the effect of ketosis. So I did two simple things. As I said, I did intermittent fasting, and then I changed my diet from processed food to real food. And it's quite simple to tell the difference. If it looks like food, it's likely food. If it comes in a box or has a label or is processed in a bag, it's not real food. So I already did those two things. And within 6 weeks, actually, I was off all my diabetic medication. I'd stopped my PPI. I had stopped my blood pressure meds. So, I had been condemned to a life of type 2 diabetes and medication forever. And just by changing my lifestyle, I was able to reverse my type 2 diabetes, hypertension. I lost 40 pounds, by the way, and I did that really without even trying. So this is not a difficult journey. It's just common sense. It's the way the body was designed. We've been fooled by big pharma, by big food, by our agencies, by the federal government into this myth. And so, people need to empower themselves. They need to take control of their life, the way they eat, how they eat, where they eat, and to realize that the agencies and the government are not interested in promoting health and well-being. That's not what they're interested in. They're interested in making money through selling you expensive drugs for which you're addicted to for life, and selling you unhealthy foods that just perpetuate the problem. So, these competing cycles. And that's the unfortunate story. At medical school, they don't teach you lifestyle changes which promote health. They basically focus on symptomatic treatment of disease with medication. And it's a really sad story.